Hello, everyone. It's good to have you join me in yet another episode of Clean Health with Dr. Drobycoucou. If you've not subscribed to my YouTube channel, do kindly click on the subscribe button, like the videos, then lay your comments in the comment section and share the videos to friends and relations for better knowledge awareness. Today, we'll be talking about a very interesting topic known as erectile dysfunction, what the layman refers to as impotence. We're going to look at the prevalence globally in sub-Saharan Africa, in Nigeria, and then we'll look at the types of erection and the process of obtaining an erection. Stay tuned as I come right back. Thank you very much for watching. Welcome back. So, what is erectile dysfunction or impotence? This is the inability of a man to obtain and maintain a penile erection firm enough to sustain a satisfactory sexual intercourse. It's a major global issue as lots of men are affected. 30 million United States men have been shown to be affected with erectile dysfunction or impotence, and it's estimated that by 2025, 322 million men will be living with this problem. In Tanzania, studies showed that 55.1% of men were affected, and some other study in a primary care setting showed 63.6% of Egyptian men were affected, with over 80% of Pakistani men with this problem. In Nigeria, a recent study showed 72.5% of Nigerian men have this issue. Most men, however, shy away from talking about this or seeing a clinician or a doctor, and they suffer secretly in silence. It will also interest you to note that over 50% of men greater than 40 years have erectile dysfunction, and the younger men feel that actually about a fifth of the younger men greater than 20 years have this problem, and they feel that they will overcome it with time, while the older men feel that it's a normal aging process. It's an ongoing problem. It affects the confidence levels, stress levels, as well as relationships. But the good thing about it is that it's largely preventable. And so why shy away from talking about it? Or why shy away from discussing it with a clinician? Occasionally, you can have erectile dysfunction under stressful conditions. For instance, if you stumble into a lion, the first thing that happens to you is that your eyes pop out. Your heart begins to beat very fast, and you be so scared. The first thing that comes to your mind is how to escape from the lion or how to protect yourself. Now, during that occurrence of that stressful condition, do you think that blood flow will increase to your penile area? Not at all. The blood flow will not increase to that area. The blood flow will rather increase to the areas in the body that will enable you escape from the lion or enable you run away from that lion. And so, of course, you don't expect your penis to rise at that point. It will drop. So, stressful conditions can give you erectile dysfunction. It can occur occasionally in men. So it's not something for men to worry about when it occurs occasionally. But when you find it occurring persistently, then it is a cause for alarm. You should try and see a clinician, okay? If you need early referral to a cardiologist who is a doctor that is trained in handling heart issues, or a urologist, a doctor that is trained in handling issues around the male organ, or any other specialist, because the management of impotence is multidisciplinary. Now, you're having erectile dysfunction is a harbinger of an underlying cardiovascular disease, and so it suggests that there is an underlying heart disease going on. So don't take it for granted. You need to see a doctor. You need to see a clinician and complain about it. Don't shy away from it. So right now, I would like us to talk about the types of erection. There's 3 major types of erection. We have the psychogenic erection, the reflexogenic erection, and the nocturnal erection. Now, the psychogenic erection occurs when a man sees a woman who is sexually appealing, and he looks at her and he's like, wow, this lady is beautiful. I want to have something to do with this lady. Okay, it can still create some form of erection, okay, or stimulus. Also, erotic talk. A lady who does some romantic talk to a man can cause some psychological stimulation, what we refer to as psychogenic erection. Now, the reflexogenic has to do with touch, as the name implies, reflexes. So if a man is touched in certain areas of his body, for instance, his nipples, the thighs, the penile area, he will be stimulated. The nocturnal erection is also referred to as the rapid eye movement sleep erection. Here, in the layman actually refers to it as an early morning erection, which they see young adults or most men who are normal actually see it early in the morning. When they have dreams or when they wake up early in the morning, they find an erection. It's a normal process. Now, no matter the source of stimulation, the process of erection is a complex process, which is a complex interplay of the brain, some hormones that are released, okay, in response to whatever type of stimulation, okay, the nerve cells, the nerves, the blood vessels, and the penile anatomy, that's the penis itself. The penis contains 2 major muscles surrounding the pathway through which the sperm passes. So if anything affects any of these pathways, whether from the brain, okay, to the nerves, to the blood vessels, okay, to the male organ, there will be erectile dysfunction. So the process of erection entails moving a penis from a soft to a hard penis, okay? And of course, we said it's a complex interplay. So the stimulus, whatever stimulus, it will send signals to some center in the brain to cause a release of some hormones, okay? What we call nitric oxide. Now, nitric oxide is a potent vasodilator. So what do I mean by that? It opens up the blood vessels, okay, and enhances blood flow to the penis. So you need enough blood flow to the penis to obtain an erection and even maintain the erection. Now, I'll ask you a question. How much blood flow do you think you need during exercise to maintain flow to the heart for you to be able to perform exercise? Do you know? So you need about 5-fold increased blood flow to the heart, okay, for you to perform your exercises or to run, okay, and so on. For you to take your penis from a soft to a hard penis, you need about 100-fold of blood supply to the penile area to ensure that erection, okay? So that's quite huge, 100-fold compared to 5-fold. When you're doing exercise, your heart will be beating, pumping fast, all right? So it's a whole lot. Now, that flow, so you need maximum blood flow for you to obtain an erection and for you to maintain that erection. The flow goes to the arteries. The arteries are the blood vessels that supply the penile area, okay? And then we have veins that take away blood from the penile area. So when the arteries are engorged from the gush of blood flow to the arteries around the penile area, it will occlude or compress on the veins that are supposed to take blood away from it. So it will block the veins and prevent them from taking the blood away. Hence, your penis will become turgid, very strong in an erect position, to move to an erect position, okay, and stay strong for you to be able to perform your functions or intercourse with your partner or your wife. All right, so that's the process of obtaining an erection. So anything that affects that whole process, okay, will give you erectile dysfunction. Right. So I hope you enjoyed listening to this talk. I would like you to subscribe if you've not yet subscribed. Lay your comments in the comment section if you have any questions, or contributions, and then do like the videos and share it to your friends. Thanks so much for listening. Stay tuned for the next episode where we'll talk about the causes of erectile dysfunction. Thanks so much for listening or watching. Goodbye.